Asbestosis. The name itself might not ring a bell, but its impact on the lives of those affected can be profound. In this video, we'll delve into the world of asbestosis, what it is, what causes it, and how it can be managed. Asbestosis is a chronic lung disease caused by inhaling asbestos fibers. Asbestos was once widely used in construction and various industries due to its heat resistance and durability. However, when asbestos-containing materials are disturbed, microscopic fibers are released into the air. These fibers, if inhaled, can become lodged deep within the lungs, setting the stage for a lifetime of potential health problems. Once inhaled, asbestos fibers trigger a cascade of inflammatory and fibrotic responses within the lungs. These fibers, being indigestible by the body's immune system, persist in the lung tissue. Over time, the body attempts to encapsulate and isolate these fibers, leading to the formation of scar tissue, a process known as fibrosis. This fibrosis stiffens the lungs, reducing their elasticity and impairing their ability to effectively exchange oxygen and carbon dioxide. The result is progressive and irreversible lung damage. Historically, asbestosis was primarily observed in workers involved in asbestos mining, milling, manufacturing, and construction. Occupations such as insulators, pipefitters, shipyard workers, and demolition crews were at particularly high risk. While regulations have significantly reduced asbestos use in many countries, the legacy of past exposures continues to impact individuals, and cases still arise, particularly among those with historical occupational exposure. The time between initial exposure and the development of symptoms, known as the latency period, can be decades, often ranging from 20 to 40 years. The symptoms of asbestosis typically develop gradually over many years. Shortness of breath, especially with exertion, is often the first noticeable sign. Persistent dry cough, chest tightness or pain, and a crackling sound in the lungs while breathing, known as rales, are also common. In advanced stages, asbestosis can lead to fatigue, weight loss, and clubbing of the fingers and toes, where the fingertips become rounded and widened. Diagnosing asbestosis involves a comprehensive approach. A thorough medical history focusing on potential asbestos exposure is crucial. A physical examination, including listening to the lungs for characteristic sounds, is performed. Imaging tests like checks, rays, and CT scans can reveal lung scarring and other abnormalities suggestive of asbestosis. Pulmonary function tests, which measure lung capacity and airflow, are essential for assessing the severity of the disease. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. Asbestosis is not generally classified into distinct types, but rather staged based on the severity of the disease. These stages are often determined by pulmonary function tests and imaging findings. The staging helps doctors understand the extent of lung damage and tailor treatment plans accordingly. More advanced staging indicates more severe lung damage and typically more profound breathing difficulties. Unfortunately, there is no cure for asbestosis, as the lung damage is irreversible. Treatment focuses on managing symptoms and improving quality of life. Pulmonary rehabilitation programs can help patients learn breathing techniques and exercises to improve lung function. Oxygen therapy may be necessary to supplement low oxygen levels in the blood. Medications, such as bronchodilators, can help open airways and ease breathing. Regular monitoring for complications like lung cancer and mesothelioma is also crucial. The most effective way to prevent asbestosis is to avoid asbestos exposure. This includes adhering to strict safety regulations in workplaces where asbestos may be present. Proper handling and disposal of asbestos-containing materials are essential to prevent the release of fibers into the air. If you suspect asbestos exposure, consult with a healthcare professional to discuss potential risks and monitoring strategies. The prognosis for asbestosis varies depending on the severity of the disease and the individual's overall health. The condition is progressive, meaning it tends to worsen over time. Asbestosis significantly increases the risk of developing lung cancer and mesothelioma, a rare and aggressive cancer of the lining of the lungs, abdomen, or heart. Research is ongoing to explore potential therapies that can slow the progression of asbestosis and improve outcomes. Current research involves exploring new methods of detecting asbestos fibers in lungs for better early diagnostic approaches and methods to mitigate the inflammation and fibrosis after exposure.